We all know it's good to pump iron, but should we be supplementing with it? I've looked into the research and I'm going to be classifying iron supplements as either helpful, harmful, or just a plain hoax. What's up guys, my name is Tessa. If you are new here, I'm a last year doctorate of pharmacy student, gonna be graduating in May. Finally, after 6 years with my doctorate of pharmacy. I'm also a NASM certified personal trainer and nutrition coach, so I'm really excited to be talking about iron supplements today. Orally, iron is used for preventing and treating iron deficiency, anemia, and other conditions that can be linked to these disease states. Unfortunately, iron is kind of a double-edged sword. If we don't absorb enough, then we risk anemia. If we absorb too much, we may be increasing our risk for diseases like cancer, heart disease, infection, Alzheimer's, diabetes, Parkinson's, and arthritis. So, we've got to be careful here. First off, I'm going to be talking about if you should even be supplementing with iron, and then move on to how to safely supplement with iron, and then end with the strategy I think is best to get the adequate iron levels in our blood. First off, the only people that should really consider supplementing with iron are those with a confirmed diagnosis of iron deficiency anemia. And even then, it can be risky. A recent study showed that there was a significant increase in oxidative stress happened within women's bodies who were on iron supplement. However, when used orally and appropriately, those 14 of age and older can still supplement with iron as long as those doses are below the tolerable upper intake of 45 milligrams. And those 45 milligrams are your daily upper limit of elemental iron. Iron and multivitamins are usually well below that dose and typically don't cause excess iron levels. I will say that the upper limit is not meant to apply to those receiving iron under like medical supervision or those trying to treat iron deficiency anemia. The reason I say this is because doses of 30 milligrams per kilogram is basically taking your body weight in pounds and dividing it by 2.2, are associated with acute toxicity, and long-term use of high doses of iron can cause multiple lung damage and can be fatal. Because the human body has no innate mechanism of getting rid of excess iron, we've evolved to regulate our absorption of it. For example, if we have low iron stores, our intestines will boost their absorption of iron and vice versa. If we have high iron stores, your intestines will kind of help block the absorption of it. However, this only works with the primary source of iron found in plants. Our digestive system cannot regulate the iron that is ingested by blood or heme iron like in animal products. The iron in animal foods can go straight through our intestine barrier even if we already have enough iron stores in our body. So how do we make sure that we're getting the right amount of iron? It's actually pretty simple. Eating a lot of healthy iron-rich plant-based food, chia seeds and pumpkin seeds, while consuming vitamin C rich foods during the same meal. Citrus fruits, bell peppers, broccoli, these can then help boost your iron absorption within your intestines. I would also try to avoid drinking caffeinated tea or coffee with your meals because this can decrease our intestines' ability to absorb iron. Now, I understand saying just eat iron-rich food is pretty vague. How do we make like Goldilocks and make sure we get our iron levels just right? Well, the first thing to do is to check your blood iron levels at least once a year, every 6 months if you want to be a little bit more accurate. This can be done at your primary care physician and usually is covered with most insurances. So in conclusion, I am classifying specific iron supplements as harmful unless they're included in like a multivitamin, like I said, those lower doses. I would never outright just supplement with high doses of iron that are past the upper limit unless, of course, you're under medical supervision, you prescribed it, you're talking with your provider. That, of course, is the exception. And I would highly recommend getting your iron from your diet and monitoring it through those blood tests. Of course, it's always to remember that natural remedies, supplements, and certain foods can always interact with medications and certain disease states. So it's super important that you talk to your provider, talk to your pharmacist before supplementing, especially with iron. Iron specifically can decrease the absorption of medications used for osteoporosis, Parkinson's disease, and some antibiotics. So you're making sure that if you are taking a multivitamin and you're on certain medications, that you're spacing that multivitamin out at least 2 hours before you take that medication or 4 hours after you take that medication. If you have any questions, make sure to put those in the comments. DM me on Instagram at the Superfood Pharmacist. That's probably the best way to reach me because I'm constantly on Instagram sending out little tidbits on supplements, sending little evidence-based guides on superfoods and how they can help with your everyday, day-to-day life. Of course, all my references are down below, and if you need anything from me whatsoever, make sure to reach out. If you like this video, make sure to do all the basic YouTube guidances, like, subscribe, hit that bell notification if you want to hear more from me. All right, guys, thank you so much for watching, and we'll see you next time.